Hello friends, I am Dr. Siddhesh Sunil Mhatre, consultant anesthesiologist from Sir H.N. Reliance Foundation Hospital. Today I am going to talk about anesthesia for ambulatory and daycare procedures. Ambulatory procedures are those wherein patients get admitted, undergoes the procedure and gets discharged on the very same day, ready to ambulate or move and carry on their routine activities. This is how the word ambulatory really came into existence. Our ambulatory anesthesia team caters a wide range of services including diagnostic and therapeutic procedures ranging from upper intestinal gas endoscopies, colonoscopies, ESWL to advanced and complicated procedures like ERCP, ESD, bronchoscopies and so on. Since most of our patients want to avoid an overnight stay after undergoing procedures, daycare procedures have become very popular. We have highly skilled professionals who specialize in anesthesia services for these procedures and are ready to provide services even for patients having advanced medical conditions which make them high risk for undergoing any procedures otherwise. This is all supplemented by emergency backup services available at our daycare OT itself with advanced equipment and well-set international standard protocols in place with pre-assigned roles in case of an emergency. Our daycare anesthesiology team has a very high patient and a procedure turnover requiring anesthetist residual effect to wane off rapidly. Our ambulatory anesthesia is balanced in such a manner that it allows quick recovery from anesthesia, leading to an early discharge and rapid resumption of daily activities, which can be of great benefits to our patients. The challenges faced by our anesthesiology team while sedating these patients are very unique when it comes to daycare procedures. But we are ready to deal with it. Your safety and well-being are of prime importance to us when you undergo any procedure. At first, all our patients undergo a mandatory thorough pre-anesthesia assessment in which we take medical details of our patients, do an examination and all the necessary investigations prior to undergoing the procedures. Now, when patients reach the ambulatory unit, they are advised to stay nail by mouth for 6 hours prior to surgery and advice regarding necessary medications to be taken and those to skip on the day of procedure is given. Once the patient reaches the ambulatory unit, we quickly review above details of our patient, record the vitals, take necessary procedure consents and secure an IV. Later, these patients are wheeled in the endoscopy theatres where your vital parameters like blood pressure, oxygen saturation, heart rhythm, ECG are continuously monitored. We provide supplementary oxygen with the help of nasal prongs or mask, after which we inject our anesthesia medicines through the IV cannula, making sure that the patients are relaxed and adequately asleep to and ready to undergo the procedure. While doing all of this, we continuously monitor vital parameters, breathing, assuring the safety of our patients and at the same time continuously supplementing with anesthesia drugs, making sure that the patient is adequately asleep. Once the procedure is done, we wake our patients within a few minutes. Then patients are shifted back to the ambulatory unit with vital monitors attached once awake and adequately conscious. A couple of hours, patients are allowed oral water intake. The patients can then be discharged later on the same day once they fulfill the protocolized discharge criteria from ambulatory unit. So even if procedures done in daycare are of short duration or they are minor diagnostic procedures, the anesthesiologist has a task in hand like any other major surgery, assuring well-being of the patient at all times. From the entire discussion, it is very clear that a very fine balance of anesthetic medications is needed considering patient comfort, a well-sedated patient to the endoscopist and at the same time quick recovery from anesthesia medications. And this is what makes providing anesthesia for GI endoscopy more unique than many other subspecialties of anesthesia.